It's one of those things where as the jowls keep falling, there comes a time when we move out of the silicone arena and we move into the short scar facelift arena. So essentially, camouflaging the appearance of jowls, in my experience, has only been useful in patients around 50. Over 50, when the jowls become more prominent, they really benefit from liposuctioning the bottom of the jowls, liposuctioning the neck, and repositioning the facial skin up north with a short scar facelift.
Okay.
What IPL, or intense pulse light, is helpful for is eliminating redness of any sort. It can eliminate redness associated with rosacea, red nose, red cheeks. Very good at eliminating that and eliminating brownish discoloration in lighter skinned patients. But I did not refer to intense pulse light treatments for the correction of overcorrection or injecting too much silicone.
Okay. Okay. So in the case of an African American who might get get a shiner or something from the injection, kind of in the groove lines,
Yes.
would that just dissipate over time?
2 weeks, 2 to 3 weeks, and all bruises disappear.
Okay. Okay.
Once it's in there, it's in there.
Okay.
So I think I know what you're asking. It takes a few, in most patients, it takes a few treatments to get any particular line, wrinkle, fold, or groove filled. Because the enemy of good is perfect, and you don't ever want to put in too much because you can end up with overcorrection or nodules. But once the groove is filled, patients disappear for years.
So you don't have to keep coming back for treatments?
Right. Patients will make a date with me, they get filled, I check them 2 weeks later, we get a game plan, we set up a follow-up treatment that's no sooner than once a month from the initial treatment. And then after the second one or the third one, patients are typically very pleased, and I don't see them for a long time. An area, I'll answer the question, I'm going to define what it is. An area is, eyelid grooves is an area. Not one side, but both sides.
Right.
So eyelids
Okay.
is an area, nasolabial folds is an area, downturned corners of the mouth is an area, cheeks is an area, the nose is an area.
Correct.
So to do one area is a $750 treatment.
Okay.
I discount as we increase the number of areas to increase the amount of areas that you can get done to maximize the result. So a 2-area treatment is, as of the date of this filming, which is October 25th, 2011, a 2-area treatment is $1,350, and a 3-area treatment is $1,750.
So the more you have done, the less it becomes.
Correct. That makes it conducive to getting more done and to getting an optimum result. I have one more important thing to add off that excellent question. Everybody who's attended this seminar tonight, if any of you decide to come and see me and get a silicone treatment, there's $100 off the treatment. To everybody in this room. Yes?
So lips would be 2 areas?
Lips is 1 area.
1 area. No, but you have 2
Right, but I'm not a used car salesman, so lips is 1 area. Yes, sir. No.
Or do you feel as normal as you did prior to the injection?
You feel as normal as you did prior to the injection, but you look better. You can't feel it. You can't feel it. Silicone.
That's what I wanted to know.
Silicone
You
remains.
feel anything?
No, silicone does not. It doesn't get hard. It remains a liquid. So it's if you feel the area that's been injected, you can't tell it's there. And this is a personal communication between Dr. Barnett and myself. The allergic rate to silicone, to liquid injectable silicone, is thought to be 1 in 10,000.
Is there a test for that, so you know beforehand?
No, there's no skin test for that. And fortunately, out of the 1,300, I haven't seen one of the 1 in 10,000s.
So what in the case of rosacea, you mentioned that?
Rosacea is treated with intense pulse light, IPL. We have an intense pulse light machine. It's similar to a laser. We use the green handpiece, and it tends to cause coagulation of tiny capillaries in the skin. And usually it takes around 4 treatments for a maximum result. And it can tend to even out discolorations like unwanted redness and unwanted brown spots.
Oh, including brown spots?
Yes. What age is too late for
Yes.
rhinoplasty? I just did a nose job on a 65-year-old woman. You would be surprised. And my Dr. Glassgold taught me this, and it's absolutely true. What happens with age is the nose tends to get longer. Just like everything else. No, it's true. Just like everything else that falls to the floor, the tip of the nose tends to droop. People with a bump tend to have more of a bump as they get older. And when that becomes distracting, rhinoplasty surgery in patients that are over 65 can be extremely youthening. So as long as somebody has pathology in the nose that I'm comfortable fixing, and as long as the patient is in good enough health to undergo a general anesthesia procedure for about an hour and a half, that's about how long it takes, an hour and a half to 2 hours, I have no problem operating on a senior citizen nose. Not if I operate on them. What Dr. Glassgold told me, and it's an astute point, and I'll give you an intelligent answer to the question. In over 90% of the nose jobs that I perform, I will harvest a piece of cartilage from the nasal septum, and I'll fashion what's called a columella strut. And it's a thin strip of cartilage that measures, in most patients, about 25 millimeters long, and it's about 3 to 4 millimeters wide. And I implant it into the columella down to the bone, up to the tip, and I stitch it in place to add additional support to the tip to prevent droopage or drooping of the tip of the nose with time. So I think that whether or not a tip droops with time depends on whether or not the rhinoplasty surgeon utilizes a cartilage graft to support the tip and to maintain the position of the tip on the operating room table.
Thank you.
You're welcome.
In your website,
Step up to the mic, kid.
Be able to ask any questions.
okay. In your website, is it Eric Joseph, or if you see on your website it says E-R-I-M?
Thank you, Sabrina. There's a misprint. Yes, it's my website. It's not. It's ericmjoseph.com. Thank you, sir. That's for my girl. That's for my girl. Anybody have anything burning? Are we good? If anybody wants to ask me something one-on-one, I'll have them turn off these lights.